The president of this WBC meeting, Professor Motoshi Tajima, the outbreaks of acute infection of bovine viral diarrhea virus in a farm.
Thank you. So today, I introduce an acute and long-term infection case of BVDV in one farm. In a beef stocker operation farm in Hokkaido, Japan, about 600 cows are fed constantly. 86 cows acutely infected with BVDV were detected during 10 months, and 46 of which were BVDV positive in the peripheral blood at 2 to 3 week intervals. The detection rate was 2.1% over an 18-month period. The examination method was viral gene detection by RT-PCR using 5' UTR primers from cella. So outline of the farm was indicated on slide. 50 to 100 beef calves, all were few day to few week old, were purchased from the market or other farm in Japan every month. They were sold after about 8 months growth. The calves were confirmed as BVDV negative when they arrived at the farm at first. For the first week at the farm, they were fed in individual hatches, then moved to a calf store with a robotic milk feeding system. They were moved to pens following the growth. The prevalence of BVDV at this farm: in the past, every year, a few PIs were detected at the arrival time to the farm. At the beginning of 2016 till April, 4 PIs were detected. And on May, many calves in the calf store exhibited respiratory disorder and diarrhea, and responded poorly to the medical treatment. All calves in the store were examined again for BVDV. 16 calves in the store were BVDV positive, and 9 of them converted negative after a week or 2 weeks. However, 7 calves were died during infection, and some of them indicated long-term infection. This is a schema of individual calf. Start of the line. Start of the line of start of life of individual calves, namely birthday. Green circle is the arrival time of individual calves at this farm, and green stars indicated the negative results of BVDV examination. So all calves examined the BVDV immediately after they arrived at this farm. So the birthday were different each other, and arrival time is also different each other. And this time, all calves, 161 calves, were examined at once, again, once, and 16 calves were identified BVDV positive. During this outbreak, the newly introduction is continued, and PI calf was detected and was inhibited the invasion to this farm, isolated. The oldest infected calf was born 4 months ago and arrived at this farm 3 months ago. Virus gene of this calf was compared among the viruses from long-term infected calf, recovered calf, and severe pathogenic calf. The nucleotide homology of 5' UTR was 100% each other, and all these were BVDV2. How and when did this oldest calf infect with this virus? In order to estimate this, comparison with PI detected on arrival time before was done. Until this outbreak, 4 PIs were detected at the arrival time to this farm in this year. One of them, which was introduced on March, was recognized having highly homologous virus. The occurrence, namely first outbreak, this one, was seemed to finish once, but on August, same occurrence was recognized again. From this time, before the movement of the calves to oat milking feeding system, the owner decided that again check the BVDV, then confirm the negative and move to the robotic machine stores. But acute infection was recognized, and some of them were long-term infection during 3 weeks and euthanasia or died. After second outbreak, acute infection was continuously recognized, and long-term infection were also identified. For the protection of the prevalence, frequently examination was studied. And acute infection continued, and many cases were identified as PI because positive results were recognized twice at 3 weeks intervals. Frequently examination of illness curve, early detection and isolation could be done. Although many long-term infection was detected, prognosis poor cases is negative. Prognosis in negative convert curves decreased. By the continuously repeating of test and car in the early stage of illness, acute infection was disappeared. In order to estimate the virus character, 5' UTR nucleotide sequence of first long-term infection case were compared with US high virulent virus strain 890, German field isolate, and Japanese vaccine strain. All were different, and high virulent mutation was not exist to this occurrence. The homology of amino acid sequence of part of E2 of BVDV were almost the same among the first PI, first long-term infection, and second outbreak. All outbreak is almost the same, but a little bit different in the mutation in amino acid sequence. So summarize the prevalence. The candidate curve of long-term infection arrived at this farm at first. This curve was confirmed as BVDV negative at first and was fed as illness curve with poor growth. Then PI curves invaded this farm. These curves were identified as BVDV positive, so they should not contact in the store. But acute infection might continue in the store. Although transmission route was unclear, acute infection repeated. It has been reported that BVDV latent in testis for long term. So this morning, Professor Joe indicated this one. So, but present occurrence had no difference between male and female statistically. So by the acute infection of BVDV in the heart, a persistent infection could be established continuously by an unknown transmission pathway. In the farm, long-term infection in acute case was almost the same with PI. Thank you.